So what is adenomyosis? Adenomyosis is a condition where the innermost lining of uterus, which is called endometrium, which sheds out during every menstrual period, and that contains the endometrial gland and stroma. I am Dr. Balaji Nalwad Reddy, laparoscopic surgeon, endometriosis excision surgeon, and head of the gynecology department at Manipal Hospital, Baner, Pune. So, what is adenomyosis? Adenomyosis is a condition where the innermost lining of uterus, which is called endometrium, which sheds out during every menstrual period, and that contains the endometrial gland and stroma. When this endometrial glands and stroma develops within the second layer of uterus, that is called myometrium, the condition is called adenomyosis. And when the endometrial glands and the stroma develops outside the uterus, the condition is called endometriosis. Most of the time, endometriosis and adenomyosis runs together. Now, why do we need to celebrate Adenomyosis Awareness Month? All over the world, there are so many millions of women who are suffering because of the adenomyosis in silence. The symptoms that are associated with adenomyosis are irregular menstrual bleeding, painful menstrual period, and these are the common symptoms of so many other gynecological conditions. That's why the diagnosis of adenomyosis gets delayed. So, what are the symptoms of adenomyosis? During initial stage of the disease, as I have explained, due to painful menstrual period or prolonged or heavy menstrual bleeding are the only symptoms. As the disease advances, the symptoms, in addition to the previous, other symptoms develops like chronic pelvic pain, pressure in the pelvis, bloating sensation pre, during, or post menstrual period, painful intercourse, infertility, subfertility, or undesired outcome during pregnancy, like preterm delivery, intrauterine growth restriction, or rising blood pressure, that is called preeclampsia. Because of lots of sufferings, a lady will have poor quality of life and will have a substantial impact on her physical, mental, social, sexual, and economical well-beings. Now, what is the treatment for adenomyosis and how do we diagnose it? For diagnosis, clinical suspicion is very important and ultrasound is the conclusive for the diagnosis of adenomyosis. MRI is required when we are planning for the surgery. Regarding treatment, during initial stage of the disease, the adenomyosis can be managed by giving painkillers and hormones. But during the advanced stage of the disease, treatment is very unsatisfactory and frustrating for the doctors as well as the patient. Surgery is required to manage advanced stage of the disease. Even with an expert hands, and after performing radical excision of the adenomyosis disease by laparoscopy, the recurrence of the disease is not less. Definitive treatment for adenomyosis is either removing the uterus with ovaries or menopause. Pregnancy definitely helps in halting the progression of the disease. Infertility management is not easy in adenomyosis patients because endometriosis is usually associated with adenomyosis. And whatever breast treatment you provide to these patients, even after doing in vitro fertilization, the risk of failure of implantation is high, abortion possibilities are more, and of course, pregnancy related complications are on the rise. We need a team of doctors to manage this condition, which includes a gynecologist, psychiatrist, psychologist, physiotherapist, and if required, help of urologist or a gastrosurgeon. And last but not least is the support from family members, which is very much required because that is the reason why we are celebrating April month as Awareness Month.